Hey guys, so the topic that I'm going to be talking today about is something called aseptic meningitis, more commonly known as viral meningitis. So, first and foremost, what is meningitis? Meningitis is when the fluid that lines your brain and your spinal cord is infected. So, that fluid is referred to as cerebrospinal fluid. So, there's different causes of meningitis. Meningitis can be brought on by a fungal infection, it can be brought on by a bacterial infection, and it can also be caused by a viral infection. So I'm going to be talking about viral meningitis only because it's more commonly seen in children and it's less severe in children than it is in adults. So, viral meningitis, like I just said, more common and less severe than bacterial. When a fungus or underlying disease causes it, a child will need treatment. If a virus causes it, there's no specific treatment. The symptoms that occur in an infant, the infant will have a spiked fever, so increase in temperature. The infant will be cranky and restless. They'll have poor eating habits, or they may not eat at all, and that's alarming when you have an infant that doesn't eat. They have difficulty being aroused. When I say aroused, I mean waking up from their sleep, so it's difficult to awake them. Also, seizures. Seizures is a big red flag for meningitis in infants. Okay, for children, also increased temperature, so fever, headache, light sensitivity. So, your child will develop headaches when they're in the sun or when they're in areas that are well lit. That's referred to as light sensitivity. Nausea and vomiting, which is pretty basic. Loss of appetite as well. Extreme sleepiness, also difficulty waking up. Seizures as well. But the biggest one in children, also adults, to watch out for is something called nuchal rigidity, which is commonly known as stiff neck. So in children and in adults, stiff neck is like the major sign that you have some type of infection in your spinal cord, and meningitis would be the first thing that they would try to rule out. So the risk factors: being exposed to viruses that would cause meningitis, being in a daycare or a school setting, mosquito or tick bites, or having a weak immune system. Some people have other conditions that weaken their immune system, and therefore they're more prone to getting meningitis than a healthy person. So people who may be HIV positive, children that have lupus, plaque psoriasis, rheumatoid arthritis, cancer, anything to that effect, anything that weakens your immune system, you'll be more prone or more susceptible to catching viral meningitis. Viral meningitis is usually a complication of very common viruses such as the enterovirus, influenza, and also varicella, which is commonly known as chickenpox. These viruses are most commonly, or they live in daycares and schools. So usually your child will contract these from other kids that they encounter. Aseptic meningitis or viral meningitis is serious, but kids usually recover completely. So that is a good thing for parents who have children who do develop viral meningitis. The prognosis is very good. However, any signs of meningitis are always a medical emergency. So any of the symptoms, especially the stiff neck, combined with the fever and the difficulty of being awake, or in combination with seizures, all of these things should, definitely ring bells in your head that, oh, maybe my child is developing meningitis and I definitely need to bring them to the ER or to urgent care. Okay, so treatment. These are things you can do to help the child feel better while the body fights the infection. It includes over-the-counter meds for pain and fever, such as Advil or Motrin, which is basically ibuprofen. There are two different brand names for the same drug. And then everyone knows about Tylenol, which is also known as acetaminophen. That is the generic name for Tylenol. as well as getting plenty of rest and drinking lots of fluids. So any child with symptoms of viral meningitis needs to see a pediatrician. And what they're going to do at the doctor is they're going to rule out bacterial meningitis. And once it is ruled out, they usually send you home with over-the-counter drugs. Okay, so preventative measures. Preventing viral meningitis is as simple as hand washing and instilling hand washing in your child's life. As basic as it may sound, it's extremely important in preventing catching a lot of these common viruses and bacterias. So preventing viral meningitis is not possible, but you can prevent the spread of the underlying virus. So a lot of the viruses that cause viral meningitis are spread through saliva, mucus, and stool. So some of the things that you want your child to get in the habit of doing is washing their hands before eating, after using the toilet, and after coming home from school or daycare. You don't want your child to share food, glasses, drinking glasses, or utensils with any other kids at school. A lot of parents are on the fence about vaccinations. I personally believe that vaccinations help you. I know there's a lot of conspiracy theorists out there that believe that, vaccines cause autism and all these types of things. But I'm just stating facts. So vaccines for measles, mumps, and chickenpox, also known as varicella, are key in defending your child against viral meningitis. Also, you want to protect your child from mosquito and tick bites. So using those sprays, or if you guys are leaving the country and going to an area of the world where malaria is prevalent, you want to get your child vaccinated before you leave the country.